Today, we'll discuss on the topic fat-soluble vitamins and their biological functions, Part 1. Now we'll look at the introduction. The vitamins are accessory food factors which are organic in nature and must be supplied from outside to maintain health, growth, and state of the well-being of a person. Vitamins are a group of unrelated organic substances occurring in many foods in small amount and necessary in trace amounts for the normal metabolic functioning of the body. Vitamins are usually grouped and distinguished according to their solubility in either fat or water as fat-soluble vitamins and water-soluble vitamins. Fat-soluble vitamins can only be absorbed in the presence of fat. Fat-soluble vitamins are generally associated with fatty foods such as butter, cream, vegetable oils, and fats of meat and fish. Not much of fat-soluble vitamins are lost in normal cooking procedures. Fat-soluble vitamins include A, D, E, and K. Food differs greatly in the amount and kinds of the vitamin D supply. First, we'll discuss the vitamin A, vitamin D, and their biological functions. We'll see vitamin A. Vitamin A was discovered in 1909 when McCallum and Davis observed that a fat-soluble substance was necessary for the growth of animals. Vitamin A is an alcohol and it has been named retinol because of its specific function in the retina of the eye. Metabolically, active forms of the vitamins include corresponding aldehyde, that is the retinal, and the acid, retinoic acid forms. There are two basic dietary forms of vitamin A. One of these is preformed vitamin A retinol. The other basic dietary forms of vitamin A is provitamin A or the beta-carotene. This substance in its natural form is found only in animal sources and is usually associated with fats. It is deposited primarily in the liver but also in small amount in the kidneys and fat tissue. In this form, its dietary sources are mainly the fat portion of the dietary product, egg yolk, and storage organs such as liver. Plants provide a source of vitamin A for animals in the form of orange-yellow pigment called the carotenoids. The chief source in human nutrition is beta-carotene, which the body converts to vitamin A in the intestinal mucosa during absorption. Beta-carotene is the most common precursor of vitamin A and supplies about 2/3 of the vitamin supply in human nutrition. We'll see the unit of measures of vitamin A. Vitamin A activity in food was expressed in international units with the following equivalences. 1 international unit is equal to 0.3 microgram retinol. 1 international unit is equal to 0.6 microgram beta-carotene. 1 international unit is just equal to 1.2 microgram of other provitamin A carotenoids. The Food and Agriculture Organization and World Health Organization Expert Committee has decided to abandon the expression of vitamin A value of food as international units and proposed that vitamin A activity be stated as the equivalent weight of retinol, that is, retinol equivalent. 1 retinol equivalent is equal to 1 microgram of retinol or 6 microgram of beta-carotene or 12 microgram of other provitamin A carotenoids. Biological functions of vitamin A. Vitamin A role in visual adaptation to light and dark has been well established. It also has a number of more generalized functions that influence epithelial tissue integrity, growth, and reproduction functions. Vision. The eye's ability to adapt to changes in light depends on light-sensitive pigment called rhodopsin, commonly known as visual purple in the rod of retina. Rhodopsin is composed of vitamin A substance, retinol, and the protein opsins. When the body is deficient in vitamin A, the normal rhodopsin cannot be made and the rods and cones of the retina become increasingly sensitive to light changes, causing night blindness. This condition can usually be cured in a half hour or so by an injection of vitamin A, that is retinol, which is readily converted into retinol and then to rhodopsin. Epithelial tissues. Vitamin A is necessary to build and maintain healthy epithelial tissues, which provide our primary barrier to infection. The epithelium includes not only the outer skin but also the inner mucous membrane. Without vitamin A, the epithelial cells become dry and flat. They gradually harden to form keratin, a process known as keratinization. When the body is deficient in vitamin A, many abnormal changes in the epithelial tissue occurs, which includes, number 1, the cornea dries and hardens, a condition called gerophthalmia. In extreme deficiency, the process may progress to blindness. Number 2, the ciliated epithelium in the nasal passages dries and the cells are lost, thus removing a barrier to entry of infection. The salivary glands dry, the mouth becomes dry and cracked. Number 3, mucosal membranes secretion decreases, show that tissues dries and slough off, affecting digestion and absorption. Number 4, a condition called follicular hyperkeratosis occurs in which the skin becomes dry and scaly and small pustules are hardened, pigmented, popular eruption forms around hair follicles. Number 5, special epithelial cells surrounding tooth buds in gums tissues that normally become specialized cup-shaped organ called amyloblasts may not develop properly. Next is growth. Retinol phosphate synthesis from retinol is necessary for the synthesis of certain glycoproteins which are required for growth. And early symptoms of vitamin A deficiency is loss of appetite, followed by cessation of growth, then rapid weight loss, and ultimately death. In vitamin A deficiency, bones become weak, although thicker than normal. The cavities in the skull and spinal column do not enlarge to make rooms for the growing nervous systems. Reproduction. The retinoids are necessary to support normal functioning of the reproductive system in both males and females. In tests with animals, the lack of retinol and retinol produces sterility, testicular degeneration in males, and aborted or malformed offspring in females. Now we'll see the health benefits of beta-carotene. Carotenes are important due to 3 attributes: their color, their vitamin A activity, and their potential as anti-cancer agent. Beta-carotene is the most important form, and being the major dietary sources of vitamin A, it acquires nutritional significance, which includes, number 1, many epidemiological studies have found that a high intake of food rich in beta-carotene is correlated with a reduced risk of certain cancers. Number 2, beta-carotene may also be an important nutritional weapon in the fight against cardiovascular disease. Number 3, cataracts are areas of opacity in the lens of eyes. Their formation has been linked to damage by oxidizing agent and free radicals. It has been suggested that beta-carotene may protect against cataracts by decreasing the level of oxidative damage in the body as whole. Hypervitaminosis A. Hypervitaminosis A is manifested by joint pain, thickening of long bones, loss of hair and jaundice. Excessive vitamin A may cause liver injury with resulting portal hypertension and ascites. We'll see the food sources of vitamin A. Vitamin A is present in animal foods only. Liver is the richest source of vitamin A. Other sources include butter, ghee, milk, curds, and egg yolk. Refined oils and vanaspati ghee are good sources of vitamin A. Vitamin A is not present in vegetable foods, but these foods contain the pigment beta-carotene, which is the precursor of vitamin A and is therefore known as provitamin A. Leafy vegetables such as spinach, coriander, drumsticks, leaves, as well as ripe fruits such as papaya, mango, and yellow leafy vegetables contain greater beta-carotene. Liver oil of shark, halibut, cod, and swordfish are some of the richest sources of vitamin A. Recommended daily intake. According to the World Health Organization and Food and Agriculture Organization, the daily requirement of an adult for vitamin A is of the order 750 microgram of retinol or 300 microgram of beta-carotene per day derived from foods of either animal or vegetable origin. The allowance for infant is 300 microgram to 400 microgram. The need gradually increases as the child grows to adolescence. No increased allowance during pregnancy is recommended, but the allowance is increased to 1,380 or 4,600 microgram of beta-carotene during lactation. Deficiency. Prolonged deficiency of vitamin A may produce skin changes, night blindness, and corneal ulceration. In extreme deficiency state, the mucous membrane of the respiratory, gastrointestinal, and genitourinary tract does not function normally and are loss of defense against infection. Vitamin A deficiency can lead to keratinization of the cornea, resulting in gerophthalmia. This is an important cause of blindness in poorly fed children in developing countries like India. Vitamin A deficiency results in the skin becoming dry, scaly, and rough. Now we'll come to vitamin D. Vitamin D is also known as sunshine vitamin as it can be synthesized from sunlight by our body. It is chemically related to steroids, essential for normal bone and tooth structure. Two compounds with vitamin D activity are involved in human nutrition: vitamin D2, hygrocalciferol, and vitamin D3, cholecalciferol. The much more significant one of this is D3. Cholecalciferol is the chemical name usually given to vitamin D in common uses. It is formed by the sun's ultraviolet radiation of 7-dehydrocholesterol in the skin. Biological functions of vitamin D. Absorption of calcium and phosphorus. The vitamin D stimulates the active transport of calcium and phosphorus from the small intestine. Without the presence of vitamin D, formation of strong and rigid bond is not possible. Bone mineralization. After it has added calcium and phosphorus absorption, vitamin D hormones continue to work with these minerals to form bone tissue. It directly increases the rate of mineral deposit in bones, the process by which bone tissue is built and maintained. Vitamin D stimulates the formation of protein osteocalcin. This protein is likely to be involved in the deposition of calcium salts in bone. Basic cell processes. Beyond the role in bone and mineral metabolism, evidence is growing that vitamin D is involved in widespread basic cell processes with targets in a number of organ tissue such as brain, kidney, liver, skin, reproductive tissue, hormone-secreting glands, and certain cells of the immune system. More recently, carcinogenesis-related functions were identified for vitamin D, including cellular differentiation, T-cell-mediated immunity, cell cycle errors, and apoptosis. Vitamin D may have important extra role in the prevention of cancer, autoimmune disease, diabetes, and other disorders. Vitamin D may prevent the inflammation that causes bleeding gums, keep gums healthy by fighting inflammations. Now, we'll see the deficiency of vitamin D. Deficiency of vitamin D results in poor absorption of calcium and phosphorus from the intestine and excess loss of them in the urine and feces. Concentration of calcium in the plasma is diminished and it produces tetany, which is characterized by hyperexcitability of the nervous system. This stimulates the parathyroid gland to decalcify bone calcium to raise the plasma calcium level. Deficiency of vitamin D leads to rickets in children and osteomalacia in adults. We'll see about the rickets. Rickets is characteristically most severe in children between the age of 1 and 3 years. Strong and rigid bones are not formed. Poor growth and bone deformation such as bowed leg, beaded ribs, and large joints and skull deformation are the characteristic features of rickets. The teeth of the children may fail to develop normally because of poor calcification. It may have pits and cracks which render them prone to decay. In young girls, improper formation of the bone of the pelvis may result in difficult deliveries of babies later on in their life. Osteomalacia. A condition similar to rickets may develop in adult women due to lack of vitamin D. This deficiency disease is common among women who have had many pregnancies and have nursed their children for long periods. The bones may become so weak that they not bear the weight of their bodies and may bend or break. Pain, softening, and tenderness in their bones and fractures are the common complaints of the patients of osteomalacia. We'll see the source of vitamin D. Irradiation of the skin with sunlight is the main source of vitamin D. The midday sun is rich in ultraviolet light and helps in synthesizing these vitamins. Food are not a good source of vitamin D. It is found in small quantities in liver, egg yolk, milk, butter, and ghee. The richest source known is the fish liver oil. Fish liver oil not form part of the diet and have to be taken as supplement. Some brands of butter are fortified with vitamin D. Recommended dietary allowance. The recommended dietary allowance is 10 microgram of cholecalciferols, which is equal to 400 international units daily for children and for women during pregnancy and lactation. The daily allowance for young adult is 10 microgram and for older is 5 microgram. Hypervitaminosis D. Intake of excess amount of vitamin D is toxic to the body and causes irritability, nausea, vomiting, and constipation. Now, we'll see the conclusion. From the present discussion, we came to the conclusion that vitamins are also a part of nutrients besides carbohydrate, proteins, fats, and minerals. Vitamins may be fat-soluble and water-soluble, depending on their solubility either in fats or water. Fat-soluble vitamin can only be absorbed in the presence of fats. Vitamin A, D, E, and K are the fat-soluble vitamins necessary for the health of a person, even they are required in minute quantities. Its absence may lead to serious disease or disorder. Beta-carotene is a precursor for the synthesis of vitamin A, and vitamin D is synthesized in our body from sunlight. Vitamin A is the key for good vision, a healthy immune system, and cell growth, while vitamin D is essential for strong bones by helping in absorbing calcium and phosphorus from diet. So, Our body needs the appropriate amount of these vitamins in our diet in order to prevent from certain disorder due to deficiency of these vitamins.